Hey, what's up? It's Privacy J here. It's time for another Sunday's live stream. Now, I've been telling you guys, I was having 2 weeks off from the stream. So, happy belated Easter, everyone. Getting some of the Easter eggs as well. So, also I was busy with schools and stuff and programs and all the time. So, yeah. Also, COVID is not over yet, but it's still spreading. So the virus is still there, according to the mayor and governor. So now before we go over to the topics, so I'm gonna go over some total hospitalizations. Now, 4,083 total hospitalizations. It's dropping. It's dropping because it's everything that is going, getting closer. And also vaccinations. The vaccination update is total doses administered 11,858,991. Total doses administered over past 24 hours, 189 and 820. So 37.4% of the at least one dose. And 24.4% of New Yorkers with completed vaccine series. Now I'm gonna go over today's topics. So I will continue some today's topics. So where we left off. So I'm gonna go over the reading. So yeah. Don't put away the mask. Don't put away the mask yet. The one factor that no one can predict is individual behaviors.
Bavnani
says that means following the guidelines. Oh, sorry, I just pressed the wrong button. Sorry about that, guys. I just pressed the wrong button. Where is it? Oh, there we go. Sorry, guys. I have to read this again. Bhavnani says that means the following guidelines. This week, the Centers for Disease Control and Prevention released new guidelines about who can socialize without wearing masks. 2 houses of fully vaccinated people or 1 household fully vaccinated with another household who is not vaccinated but is in the low risk category, but do not have to wear masks when together. According to the new guidelines, everyone else needs to continue wear the mask, stay 6 feet apart, and they need 6 feet, but be in well ventilated areas and wash their hands. We can start doing something, although it's not everything, Bevnani says. So, right now, doctors' biggest worry is spring break. Hey, what's up, Metro Elevators? I'm just trying to do some. Anyway, right now, doctors' biggest worry is spring break. Austin has seen big surges of cases come 2 weeks after Memorial Day, 4th of July, Halloween, Thanksgiving, Christmas, and New Year's. These holidays taught us that even small group gatherings create spread. All right, narrator, you go.
It's like a roller coaster, Avnani says. Every time we start pumping the brakes, I breathe a sigh of relief. Every time we let up, we start accelerating, I get a little scared. The variants are scary. Watson worries that people are going to stop doing the things we know work. We've already lost over 500,000 people, he says. It could go as high as 1 million if we start relaxing.
So masks will be the normal throughout this year and even into next year. This summer, as long as the variants behave themselves, we will be able to get together and have larger groups, says Metzger. But that will be with wearing masks. Your turn, narrator.
Austin residents have done a good job this year wearing masks and staying socially distanced compared with other cities, Metzger says, which is why our surges have not been as bad. We have to continue to do that.
Every time we start pumping the brakes, I breathe a sigh of relief. Every time we let up, we start accelerating, and I get a little scared. That variants are scary. Your turn, narrator.
Bhavnani is making her own plans for fall, but she says, even then, I don't think we're going to get back to pre-COVID normal life. The new normal is going to look a little different, she says. She believes we'll start to have more in-person activities while still wearing masks. We're going to need to be smart and take baby steps and watch the rates of an infection and what's going on around us, Avnani says. As long as we're smart about this, grandparents might see a grandchild.
Keep going.
Once we have a vaccinated population, we could get to a point where we can have concerts and outdoor sporting events again, Watson says, but masking might be part of the future for a certain part of the population. There will be a lot of hugging, a lot of vacation, a lot of travel once everything calms down, Hatton says.
Now, a future after the coronavirus. The coronavirus will change how we deal with illness, Bhavnani says. It will be a while before it's off our radar, she says. Many communities around the world have made it the practice to wear masks during cold and flu season or for people who are sick. And I think it will be no longer to be acceptable for someone to have sniffles and be in the same room, she says. Go ahead, narrator.
Employers will be happier to have people working from home when they are not feeling well. She says she believes we'll have at-home testing available so people can make sure they're not infectious before going out. Coronavirus also taught important lessons about disparities in healthcare equity and the importance of putting money into public health, she says.
Keep going.
It also taught us what happens when we put off preventative care. Watson says he believes that even when his hospital's COVID-19 numbers decrease, they will still be full. This time it will be with patients who delayed care because of fear of the virus. Hospitals across central Texas are starting to see patients coming in with heart disease, strokes, cancer, and diabetes who are far more sick than before the pandemic. He wants people to get vaccinated, yes, but to also stay connected with their doctors and get preventative care. We don't want to lose the ground we gained over the past decade, Watson says.
So, the pandemic anniversary updates. American Statesman reporter Kay Hall with interview Austin public health officials at 9:30 a.m. Saturday to talk more about the anniversary of the coronavirus pandemic in Travis County. To check statesman.com throughout the day Saturday for updates on coronavirus cases, trends and the status of vaccination efforts. Yeah, more topics on the next Sunday live stream. Let's move along. So, when will the pandemic end? Life to return to normal. So, I'm gonna give you guys 1 second. So yeah. Okay. Anyway, these 4 factors will influence how quickly the U.S. can achieve herd immunity. When can we all get back to normal? As the COVID-19 vaccination rollout gains speed, that's the question on the mind of many Americans. Unfortunately, the answer is less than clear cut. Experts says we first need to reach herd immunity, which is achieved when a significant proportion of the population becomes immune, mostly through vaccination, so the coronavirus can no longer spread easily. White House Chief Medical Advisor Anthony Fauci is estimated that 70 to 85% of the US population needs to be vaccinated to develop a blanket of protection over the country and very little viral activity. Your turn, narrator.
Monica Gandhi, MD, an infectious disease doctor and professor of medicine at the University of California, San Francisco, says we will know we're on the road to normalcy based on what's happening in hospitals and in the community. We will know it when we see it, she says. First, hospitalizations will be massively reduced because people can't get severe disease after they're immunized. Second, cases will be so low that even when people have respiratory symptoms and tests, they won't have it. Estimates of when we will reach that point are all over the map. Some experts predict a return to normalcy as soon as April or May, while others say it may not be until 2022. The wide discrepancy reflects the reality that a range of complex factors could affect the timeline in ways both good and bad. Here are 4 of the biggest variables that will determine when we can return to some semblance of normalcy.
The pace of vaccination. Oh no, the pace of vaccination. Excuse me. Sorry. Narrator.
Probably the most important factor is the speed of the vaccine rollout. If the US administers 1.9 million doses a day, the average vaccination rate in early March, it would take an estimated 7 months to cover 75% of the US population with a 2-dose vaccine, according to a Bloomberg projection. But it likely won't take that long, experts say, because vaccine makers are ramping up production, with the potential to significantly boost the number of vaccinations administered per day. President Joe Biden announced March 2nd that he expected there would be enough doses of coronavirus vaccine available for the entire U.S. adult population by the end of May, though he says it will take longer to get all those shots in arms. We're moving in the right direction, but if you map out estimates of when we vaccinate enough people for a return to normalcy, we're still well into the summer, says Cameron Wolfe, MBBS, an infectious disease specialist and co-chair of the clinical COVID-19 task force at the Duke University Medical School in Durham, North Carolina. The other question mark is when we'll have a vaccine that's approved for children, says Christopher Murray, MD, director of the Institute for Health Metrics and Evaluation at the University of Washington in Seattle. The Pfizer-BioNTech vaccine is authorized for use in people 16 and older, while vaccines from Moderna and Johnson & Johnson are authorized for adults 18 and older. Although testing in children has started, health officials anticipate the vaccines may not be available to them until late 2021 or 2022. Children are a quarter of the population, Murray points out. To reach herd immunity, Murray believes, we first need to get a vaccine for kids, and then have close to 80% of kids and adults be vaccinated.
Number 2, how long natural immunity lasts. Narrator, how long natural immunity lasts?
If you factor in Americans who have immunity from past coronavirus infections, the country could potentially reach herd immunity faster, some experts say. Marty McGarry, MD, of the Johns Hopkins School of Medicine and Bloomberg School of Public Health in Baltimore, writing recently in the Wall Street Journal, estimated that about 55% of all Americans likely have some natural immunity. When you combine that with the pace of vaccinations, he predicted that coronavirus infections would drop to an extremely low level by the spring. As more people have been infected, most of whom have mild or no symptoms, there are fewer Americans left to be infected, McGarry wrote. At the current trajectory, I expect COVID will be mostly gone by April, allowing Americans to resume normal life. Others say that's too optimistic, noting that the number of Americans who have natural immunity may not be that high and that no one knows how long natural immunity lasts. There is data that indicates even if you've been infected, you can still be reinfected, says Louis Mansky, PhD, director of the Institute for Molecular Virology at the University of Minnesota in Minneapolis. The type of immunity that you get from an infection is not as good as what you get from the vaccine. 3. More contagious virus variants. Mansky and Murray says they believe variants, new strains of the coronavirus that are more transmissible, are the biggest factor that could lengthen the time it takes to get us back to normal. The current COVID-19 vaccines have been found to work against some variants, including B.1.1.7. The strain first found in the United Kingdom and that is now in at least 44 US states, but a few, such as a variant first identified in South Africa, appear to have more ability to evade vaccine protection and natural immunity. Vaccine makers are working on boosters to protect against the strains. Meanwhile, we are in a race, Mansky says, to vaccinate as many people as possible quickly, before the variants can take hold. That's also why it's so important to continue to take precautions like social distancing and wearing a mask, he added. If the variants spread faster than vaccinations can occur, we face the possibility of a new surge in cases this spring, and that will make it a lot harder to reach herd immunity. Higher levels of herd immunity are needed with a more contagious variant, Murray says. However, if we get through May and we haven't seen a spike, we will be in much better shape to be on a more predictable trajectory toward normalcy, Mansky says. 4. Vaccine hesitancy. Reaching herd immunity depends on a large proportion of Americans getting vaccinated. Surveys show the percentage willing to get the COVID-19 vaccine has gradually increased since last summer, but about 40% are still at least somewhat reluctant. In a February Kaiser Family Foundation poll, 22% said they want to wait and see how the vaccine is working, 15% said they will definitely not get vaccinated, and 7% said they will get the vaccine only if required for work, school, or other activities. Persuading those people to get vaccinated will take a lot of public information campaigns and physicians telling their patients how important it is, Murray says. Other factors that have the potential to impact our quest for herd immunity include how effective the vaccines are at stopping the spread of infection, we still don't know, and how long vaccine-induced immunity will last. What we don't want is for it to take so long to vaccinate some people that those who get vaccinated early start losing their immunity by the time we start vaccinating the rest of the population, Wolf says. new normal will likely include the coronavirus. Wolf, Gandhi, Mansky and Murray are all hopeful that some semblance of regular life will resume for Americans in the fall of 2021 or by early 2022 at the latest. But they emphasize that the coronavirus will never be totally eradicated. It's already spread too far, and it's changing too fast. Instead, they said, the goal of public health efforts is to make it a manageable virus, like the seasonal flu. The vaccines authorized for use in the US have been shown to be highly effective at reducing the number of severe COVID-19 cases and hospitalizations. Depending on how long immunity from the vaccines lasts, we may need to get the coronavirus shot every year, or once every 3 years. The coronavirus will be with us, but it will not be terrible, Gandhi says. What's important is that we don't want to get severe disease. The vaccines mean that we can defang the virus, taking it from causing severe disease to a virus that causes a cold. Michelle Crouch is a contributing writer who has covered health and personal finance for some of the nation's top consumer publications. Her work has appeared in Reader's Digest, Real Simple, Prevention, The Washington Post and The New York Times.
All right, so that was on today's topic. So we're gonna move along to the health data. So yeah, I'm not gonna type the states, but only New York. Here we go. Well, it's going a lot more easier now. It's dropping and it's doing good these days. So yeah. So map. Let's go to the maps. It's loading. Here we go. Wow, it's dropping. The numbers are dropping. Almost there. It's getting closer. It's getting closer now. So yeah. See? Now it's quickly, slowly dropping. Oh yeah. Wow. It's going down to 0, but almost. It's dropped down to 3, 2, 1. So, and it's stopped right there August 1st. So yeah. So that was your Sunday's live stream. Because that was your Sunday's live stream, guys, because every time we'll do it a next topic around next Sunday. So stay tuned for the next topic. So if you're going to subscribe for more content to Privacy J Productions and the Privacy J Productions 2, all of my social medias will let you know all about it. Facebook, my name is Jaden Garcia, and Instagram is JTech727. Snapchat is Scoots0727, and follow me on Twitter at PrivacyJNYC1. So stay tuned for number 4. So thanks for watching and peace out.